and I want to bring in Dr. Timothy Quinn and Charlie Langston, the U.S. Associate Editor for the Daily Mail. Welcome, both of you. And I do want to start with you, Doctor. The princess not revealing what type of cancer she has, but we do know it was discovered when she went in for that major abdominal surgery. And of course, you're not her treating doctor, but you say there are a few probable issues that may be at play here.
Right. I mean, she's a 42-year-old, relatively healthy female. So when we talk about abdominal cancer, that's so vague. I mean, it could be the pancreas, the gallbladder. It could be a gynecological, such as the uterus or the ovaries. But I do want to note that there's an increase in the incidence of people at a younger age getting colorectal cancer, so much so that our guideline as far as when do we start screening has been reduced from 50 all the way down to 45. So these are just some of the differential diagnoses that we can consider, but we just want to stay prayerful for her and her family.
Yeah, absolutely. And Charlie, over to you. What is the mood like in England now that the princess has revealed her cancer diagnosis?
You know, I think the feeling is one very much of sympathy. There is obviously a huge amount of heartbreak among the British people, not only for Kate herself, but also for her 3 young children, and of course her husband, Prince William, who is not only dealing with Kate's cancer diagnosis, but also his father's cancer diagnosis. And he's going through this at a time where he does not have the support of his brother, Prince Harry. The two of them are obviously in a very rocky place. And I think a lot of people in the UK are hoping that this terrible set of circumstances might at the very least help to bring William and Harry back together.
That's true. I mean, I wasn't really thinking about that. I was so focused on Kate, but you're right. Prince William, after so much public scrutiny and facing so many questions over the last few weeks, his wife and his father are both battling cancer at the same time. And Dr. Quinn, you know, the princess said that she is now undergoing preventative chemotherapy, which already started in February. What exactly does that mean?
Well, basically, she went in, she had the exploratory abdominal surgery. Cancer was diagnosed after the surgery, according to the reports. Now, there are a lot of cases where a medical team will provide chemotherapy, but I don't want the general public to think that just because it's chemotherapy, it's some terminal stage 4 cancer. But sometimes chemotherapy can be done at an earlier stage, even preventative, and that's what they're calling it. So this is usually done in the hopes that if there were some cancer cells that were left after the specimen was removed, these cancer cells can be destroyed. And then if some had metastasized or moved to distant organs, those would be caught as well. But it's just one of those decisions that's made by a medical team. And a lot of it has to do with the fact that she's young, so she has less risk of complications. But the take home is, you know, this is not a death sentence, and a lot of people are talking about the fact that if she's on chemo, this is terrible, but it's not necessarily always terrible.
Yeah, that's good context. And Charlie, you know, I want to ask just broadly, it's been a tough year for the royals. We know, of course, just months ago, King Charles revealing his own cancer diagnosis. What are you hearing about how the family is dealing with this? And is this a monarchy in crisis, in peril?
You know, obviously, for any family to deal with a single cancer diagnosis is a matter of absolute devastation. So for the monarchy to be dealing with 2 of its key family members going through such a difficult time health-wise has been heartbreaking for everyone involved in the royal family. I wouldn't say that the monarchy is currently in crisis, but I do think that this is a moment of real testing for them, and it's going to be really necessary for other members of the royal family to step up to the plate and support those senior-most members. Obviously, Kate is now out of action. Charles is doing what he can, but he needs to prioritize his own treatment. William needs to offer support to them while trying to take on what royal responsibilities he can. But I think what we're going to see is people like Princess Anne, Prince Edward, Sophie of Wessex, Princess Eugenie, Princess Beatrice, all of those other key players within the royal family kind of stepping up to take on more responsibility than ever before. And if they are able to do that, if they're able to kind of come together, really show that they have that tight-knit family bond, then I think the monarchy is going to come out of this stronger than they have ever been before.
All right, Dr. Timothy Quinn and Charlie Langston, thank you both for your time tonight.